Okay, first of all, tell me what's going on.
Still a little bit in the hip. There's a little bit of a catch,
Mm-hmm.
but it got a lot better over the weekend. And my knees are still, especially my right knee, on the inside is still a little bit sore.
Okay, and from when you first came, how have you?
Oh, it's definitely increased exponentially. So I was here last Monday, Tuesday, and Wednesday, and then I came on Friday, but not Saturday.
Mm-hmm.
And so I had the weekend off.
So consistency helps.
Oh yeah,
Okay,
absolutely.
so let's go ahead, lay on your back. So,
So I have Ehlers-Danlos, and so I have joint issues.
mhm.
And so Dr. Susan and I figured out that instead of going from top to bottom, I have to go from bottom to top.
And it has to be a system.
Yeah.
If I don't go systematically, she does not get better. So we make sure that we give every patient what they need for the best results. And because she's so flexible, the gun helps me to get into this joint that really requires attention. This one or this one?
Outside.
This one or this one?
Outside.
Go ahead. Come on up. And then we're going to do her sacrum. This one or this one?
Right.
Bend forward. Come back up. You can see there's a big difference. Go ahead and bend again. You can see that my finger separates a lot. Come back up. Bend forward again. And then when I hit the right bone, it becomes more even, knowing that we get the right spot for that nerve. Bend forward again. See, much more even. This one or this one?
Right.
This one or this one?
Right.
The reason why I'm asking right or left, it tells me which way it's rotated. So we go in the opposite of that direction. So not everybody gets the same kind of treatment. Everybody has their unique problems, and we have to address it in exactly the same way.
And then, like, I go to hands.
Oh yeah. There we go.
Where that still like a stick a little bit. I don't know if we do the
Yeah.
elbow.
That's why I did that one. There we go.
And again, like my spine, we have to go from my fingers up instead of shoulders down.
Yep. She's just very unique.
Yeah.
There we go. Exactly. Oh, that was nice. Now we're going to go back up here. Look at the shoulders. Right here, right?
Mm-hmm.
Mm-hmm. 1, 2, 3, 4.
Cheer.
This one or this one?
Left. Do I need to lie down?
Yeah.
This one.
Oh, yes. Oh, yes. Come on up. And how's the triangle?
Yeah,
Right there.
Okay. And then just want to make sure it won't walk so that I can.
Mm-hmm. And then we also have them walk around, make sure that we get it just right. And if it's not, then we reassess again and we try to make sure that it works for the patient. This one or this one? We tweak it till they're happy.
Yep, that's it.
There you go. Good job.